Hello. So now we're going to continue with the second part of antibiotics. This one, they work a little bit different from the first one that we saw. Um, this ones are less aggressive, but still effective to treat infections. Okay, let me see now. Okay, here we go. Okay, so keyword here is bacteriostatic. So on these ones, unlike the previous antibiotics, penicillins and all of them, they were considered bactericidal. And we mentioned they kill bacteria, they destroy the cell wall. This case, they are bacteriostatic. They don't destroy the bacteria, but they inhibit for the bacteria to continue multiplying. So basically, with this type of antibiotics, we inhibit the growth factor of bacteria. They don't multiply anymore. So we just let them end their normal life cycle. And that's how the infection ends. So again, keyword, bacteriostatic. Okay, so the first group of antibiotics that we have here is tetracyclines. And as you can see, they end in cycline. Tetracycline, the macrolide, doxycycline, and minocycline. So that's how you can identify them. Tetracyclines, they end in cycline. And tetracyclines, just like penicillin was one of the first antibiotics to be used. So it has a very broad spectrum. They kill gram-negative, they kill gram-positive. So they were used for a lot of infections until, well, regarding how they work, we have to limit the use. They're not that easy to use. So again, how they inhibit the bacteria. Okay, they inhibit protein synthesis. That way, the bacteria cannot multiply. That will limit the spread of the infection, and we just wait for the normal life cycle of the bacteria to finish. Just like any other antibiotic, when you abuse of one, eventually there's going to be a resistance from the bacteria. The most common use for tetracyclines here in the States is to treat acne. So that's the most common use, but it can be used for infectious diseases. It can be used for H. pylori. We mentioned that in a previous chapter, the patient with peptic ulcer secondary to an infection by H. pylori. Tetracyclines is part of that group of antibiotics used to kill H. pylori, to inhibit H. pylori. It can be used for periodontal diseases. That means that dentists, they like to prescribe this antibiotic. It can be used for rheumatoid arthritis. It can be used for Mycoplasma pneumoniae. That's a type of pneumonia. Lyme disease, anthrax, and again, we already mentioned H. pylori, peptic ulcer disease. So far, regarding the author, tetracyclines, the highlights is acne and H. pylori. For acne, can be used by itself. To treat H. pylori has to be in combination with the other antibiotics that we saw on last week. Okay, now regarding tetracyclines, keyword here, new word for you probably, chelation. That means that tetracyclines, they like to attach itself to calcium. Tetracyclines, they like calcium. So every time they see calcium, they're gonna attach itself to them. Now, tetracyclines by themselves is a very, very heavy medication. That means the patient, when they start taking tetracyclines, they're gonna complain that, stomach aches, nausea, vomiting, it's abdominal cramps, some of them. So with tetracyclines, it's very common for doctors to advise, hey, take it with meals, take it with snacks. And this is where you need to say, hey, just make sure that don't mix it with dairy products, not just milk. Dairy products, don't mix it with other minerals like magnesium, aluminum, well, calcium, tums, iron. So basically, just to be on the safe side, tetracyclines cannot be taken with other minerals at the same time. Now, if the patient, and we mentioned this a couple of times last week, if the patient is already taking antacids, we always advise take your medications first, the other ones for diseases, hypertension, diabetes, and so on. Wait at least 1 hour and then take the antacid. Okay. So, like I was telling you, this medication is heavy on the stomach, so we're gonna put it as gastrointestinal irritation. Will be MVD, abdominal cramps. We mentioned last week that tetracyclines is not advised on pediatric patients and not advised on patients that are pregnant because, again, this medication is going to go into the body and it's going to attach itself to the calcium of the bones. So the pediatric patient, that fetus, they're not going to grow properly. So that's why it says here has an effect on bones and teeth. So regarding the teeth, we're going to see staining of the teeth, and that's going to be our indicator that tetracyclines are taking away the calcium from the bone. So again, so two main groups that cannot take this medication is pediatric patients and pregnant patients because of the effects on the fetus. Also, tetracyclines, they can produce a superinfection, and we mentioned pseudomembranous colitis being the name of that superinfection. And pseudomembranous colitis is infection by Clostridium difficile or C. diff, a very, very smelly diarrhea. Probably a few of you already had that experience. If you know, you've already been on the field as a LVN or CNA. So it's a very smelly diarrhea. C. diff is the cause of it. And if it happens, you know, we need to suspend the antibiotic that produced the superinfection. After that, it's treated with metronidazole. Also, this medication can be heavy the liver, so it will be a hepatotoxicity. And part of the tetracycline is excreted to the kidneys. So it says here renal toxicity only if it's attached to calcium. So what happens here? The medication, the tetracyclines, can be excreted to the kidney, but when it's attached to calcium, it's too big of a molecule to be put in urine. So basically, it's gonna get stuck on the tissue of the kidney, and that eventually will cause kidney failure. So we have to make sure that this patient every 6 months goes to an evaluation by the doctor to see how the liver and the kidneys are. And also tetracyclines, they produce photosensitivity. So that means that they have sulfur in their chemical structure. And we mentioned that sulfur burns with heat. So it's advised patient taking tetracyclines when they go out to use a hat, long sleeves, sunscreen, and so on. And we mentioned that one of the main uses is patients with acne, teenagers with acne. So we need to advise them that, you know, take the medication as prescribed, don't take it with dairy products, and when you go out, make sure you have sunscreen on you. So like we mentioned, this is a summary. Tetracyclines, the macrocyclines, they are eliminated to urine, and they're going to produce a kidney disease if tetracycline or the macrocycline is attached to calcium. So it's advised evaluations of those patients at least every 6 months. and it's less likely on adults. This will happen more on pediatric kids. We mentioned that tetracyclines, when they attach to the calcium of the bones, the only way we can see the adverse effects is with the discoloration that they produce on the teeth. We mentioned, just like any other antibiotic, if the patient tells you, hey, I have diarrhea, we need to make sure that it's not a super infection. So you have to make sure that it's not a smelly, foul diarrhea. So if it's so, then we need to suspend the tetracycline and give metronidazole to treat that C. diff diarrhea. IV therapy, high dose IV therapy may produce liver damage. Regarding a food and drug and food interaction, don't mix it with any medication that has minerals in it and dairy products. So milk products, dairy products have calcium supplements like Tums. Don't mix it, iron supplements, don't mix it with iron, magnesium, aluminum, and so on. Because it will attach to the medication and it will not get absorbed properly. Okay, so those are the highlights regarding the tetracycline. Now let's jump to macrolides. Macrolides are medications, PO, that end in mycin. Same thing, they're bacteriostatic. That means they don't kill the bacteria, but they inhibit the bacteria from multiplying. Macrolides, especially erythromycin. This is our option when the patient mentions, hey, I'm allergic to penicillin, or I'm allergic to cephalosporins, or any medication that has a beta-lactam ring, then macrolides is our next best option. And just like penicillins, they're very good against gram-positive and gram-negative bacteria. Erythromycin, just like penicillins, it can be used for a bunch of infectious diseases like the whooping cough, diphtheria, chlamydial infections, pneumonias, skin infections, and so on. Regarding drug interactions, well, don't mix it. Oh, I forgot, and I hope you highlight this. Antibiotics, don't mix with birth control pills. Okay? Antibiotics, don't mix them with birth control pills. What happened? The thing is, antibiotics overall, it's not just macrolides. Antibiotics overall, they compete with the liver. Remember, we did a quick mention in one of the tutoring sessions that one of the functions of the liver is biotransformation or biometabolism. And that means that, whatever medication is activated, the liver's gonna deactivate it and then excrete it, or the medication is inactivated, it's gonna activate it so that the medication can do what it's designed to do in the body. So it's the same thing with birth control pills, the hormone. So when the patient takes birth control pills and antibiotics, the liver is gonna put more attention towards the antibiotic and not the birth control pill. So the birth control pill is not gonna get activated, and the patient will continue ovulating not like before she was taking the pill. So if the patient is on birth control pills, we need to advise, say, during the time period of you taking antibiotics, make sure you use a second method to prevent pregnancy. Usually we advise a barrier. It could be the diaphragm, it could be the condom. They cannot rely only on the pill during antibiotic treatment because there's a chance of the patient getting pregnant. So this is overall on all antibiotics mixed with birth control pills. We mentioned again adverse effects. Macrolides are very heavy on the stomach, so a patient's gonna complain of MVD and abdominal cramps. So because of it, we can advise, and this is for the purpose of the patient to adhere to the treatment. You can take it with a snack. You can take it with a meal. That way, it doesn't affect your stomach. Now, regarding the heart, it says here QT prolongations and sudden cardiac death. This is very, very rare, very rare to happen. But one thing, just like any other antibiotic, super infections, again, this is the smelly diarrhea caused by C. diff. We need to discontinue the antibiotic and treat it with metronidazole. The other two macrolides, clarithromycin, and as you can see, they have the mycin ending, and azithromycin, also N-mycin. So regarding clarithromycin and azithromycin, same thing, they're heavy on the stomach, and we follow the same indications as erythromycin. Regarding azithromycin, the highlight, this antibiotic is used only for 5 days. Azithromycin is used only for 5 days, once daily. Usually they call it the CPAC. That's the most common presentation of azithromycin. The CPAC, Z, Citromax, so it's a CPAC, and usually it's taken once daily for 4 to 5 days. Okay, we have clindamycin, also enzycamycin. Just like any other antibiotic can promote C. diff diarrhea or pseudomembranous colitis. If we don't identify that diarrhea can be fatal, clindamycin is advised for anaerobic bacteria. Bacteria that doesn't need air to multiply. So basically, clindamycin is used for gastrointestinal infections. That's the most common use for clindamycin. Also can be used for any other infection where there's no oxygen in the tissue. And same thing, if the patient is allergic to penicillin, clindamycin, just like erythromycin, can be used as an alternative. So we mentioned regarding adverse effects, diarrhea, or as a super infection. This is CDAT. This is the C. diff. So basically, this one and this one are the same. They're just like any other antibiotic, macrolides or medications like N-mycin, they can have patient can have allergic reactions. From all antibiotics, penicillin is the one that has the highest incidence of reaction and anaphylactic reactions. But again, you have to be careful with any drug that you give to the patient. Regarding blood dyscrasias, it can produce some types of anemias or leukopenias. Not too often, it's rare, but may happen. And regarding liver toxicity, it only happens on long treatment. Usually antibiotics are used for 7 to 10 days, and we don't see liver damage on this type of a treatment. Now we're talking about months, because we're using for prophylaxis, then we can think, hey, now we're gonna have liver damage. But on a regular basis, normal treatments, 7 to 10 days, we're not gonna see hepatotoxic effects or blood dyscrasias. Okay, so that's with the medications that N-mycin. Now let's go to new drugs, Linezolid or Cyvox. This is a new medication. It belongs to the oxacillidinans. And the highlight about Linezolid is used for infections that have resistance against vancomycin or have resistance against methicillin. So basically, it's used for MRSA infections and VRE infections. So here, if you notice, now we are adding infections that are already resistant to vancomycin. So that's when we use a Linezolid. So Linezolid also bacteriostatic. That means it doesn't kill the bacteria, but inhibits growth and multiplication. And the highlight is that is against VRE, vancomycin-resistant enterococci, and MRSA, methicillin-resistant Staphylococcus aureus. VRE are infections basically in the GI tract. That's where we're gonna see the most cases of VRE. Regarding Linezolid, is most common side effects is diarrhea, and again, this is the super infection that we have been mentioning in the last 3 chapters by C. diff. Nausea and vomiting when it's by mouth may produce headaches. The other big highlight of Linezolid is myelosuppression. So this medication can produce leukopenias, can produce neutropenias. You know, basically it's gonna affect the white blood cells. It's gonna suppress all of them. And also, this is a very important highlight. Cannot be mixed with MAOIs. So if you remember MAOIs, we talked to them, Parkinson's disease. Line was the one that we mentioned. And also person with depression. So this is the funny thing. And on a hospital setting, MRSA, you cannot see it more often, you know, co-infections in a hospital setting. You can see it more often on the psych ward. That's where you're gonna see it the most, or we have seen it the most. But Linezolid is not advised to be used on the psych ward because some patients may be taking some type of MOI for that severe depression, and that can cause a very fatal interaction with Linezolid. Okay, so those are the highlights. And let's talk real quick about other new drugs that are in the field. Dalfopristin, quinopristin. They end in pristin, as you can see right here. And they belong to a family called streptogramins. The highlight is that the indication is for vancomycin-resistant enterococci. Again, bacteria that we found in the GI system, GI tract. This one, they are not used as a first antibiotic because this one, they have severe hepatotoxicity. This one, in very short term of 7 to 10 days, they can cause liver damage. And this is an enzyme that we find, CYP3A4 is an enzyme that we find in the liver. So basically, besides producing liver damage, it's gonna shut down this enzyme, and the liver is not gonna work properly in the breakdown of waste products. Okay, so here we have another three drugs, Tetracycline. So you can see encyclines. So we can assume just by this, and most probably belongs to the tetracycline family. The only problem is it have increased mortality due to side effects. That's why it's not mentioned. And then we have ratapamulin and pyrosin. This one you need to remember it. Mu pyrosin. There are topical antibiotics. Mu pyrosin, you can find it on the shelves. No, sorry, it's a prescription antibiotic. It's a cream used for skin infections and for MRSA infections on the skin. And like I told you, MRSA is found usually on the nostrils. So when a patient starts having a little ulcer, a little skin infection near this area, mupirocin is the one that is used because it's a topical presentation. The most common adverse effects has to do with a cream that is a fat soluble, and when it's exposed to the sun, that can produce a sunburns. Okay, so that will be all for this chapter. Thank you very much for your attention, and I'll see you on the next one.